Do you frequently feel like your heart aches sometimes, or your fingers turn white when you're cold? Maybe your joints hurt for no clear reason, and you feel tired all the time, tired in a way that sleep doesn't fix. If this sounds like you, you're not alone. Some people have symptoms that look like autoimmune diseases, such as lupus or rheumatoid arthritis, but don't quite fit the full picture. This can be confusing and scary. That's where undifferentiated connective tissue disease, or UCTD, comes in. Think of it like a warning light on your car's dashboard. The engine isn't broken yet, but something is off. UCTD means your immune system is acting up, causing inflammation in connective tissues, which hold your body together, but it hasn't settled into a specific disease. Around 20 to 40% of people with early symptoms like these end up with UCTD. So why does UCTD happen? Great question. Imagine your immune system is like a security guard. Its job is to protect you from invaders like viruses and bacteria. But in UCTD, the guard gets confused and starts attacking your own body, like attacking the house thinking it's a thief. We don't know the exact cause, but it's likely a mix of your genes and your environment. For example, if your mom had lupus, you might be more at risk. And things like long-term stress, infections, like a bad flu, or even too much sun exposure can push your immune system over the edge. Think of it like a cup slowly filling with water. Genes are the size of the cup, and life events are the water. When the cup overflows, UCTD symptoms may begin. What does UCTD actually feel like? Let's play a quick game. Raise your hand if you've had joint pain in your fingers, wrists, or knees. Maybe it's stiff in the morning, but gets better during the day. How about extreme tiredness, even after 8 hours of sleep? Or a red rash across your cheeks after being outside? Dry eyes or dry mouth like you need water all the time? Some people notice their fingers turn white or blue in cold, whether it's called Raynaud's. You might also feel feverish or have muscle pain. These symptoms come and go not every day, but they're annoying and real. Unlike other diseases, UCTD often spares major organs like kidneys or lungs, at least in the beginning. But how you feel matters even if tests don't show much. How do doctors find UCTD? It's detective work. There's no single test. First, they ask, what symptoms do you have and how long have they lasted? Then, they might run blood tests, like checking for NA anti-nuclear antibodies, which are like false alarms your immune system sends. But a positive ANA alone doesn't mean UCTD. Even healthy people can have it. So doctors look at the full picture, your symptoms, blood work, and rule out other diseases like lupus or scleroderma. If it doesn't fit one specific disease but has some clues, it may be UCTD. Treatment, not always needed, but if symptoms bother you, doctors might suggest low-dose anti-inflammatory drugs, like ibuprofen, hydroxychloroquine, a gentle immune modulator, or lifestyle fixes, such as sunscreen, quitting smoking, or stress management. Think of it like tuning a car. Small fixes keep the engine running smooth. Can you stop UCTD before it starts? Not fully, but you can reduce the risk of flare-ups or turning into a more defined disease. Think of your body like a smartphone battery. Stress, no sleep, and sunburns are apps draining your power. Close those apps. Wear sunscreen every day, even when it's cloudy. UV light can trigger immune issues. Quit smoking. It's linked to more severe symptoms. Exercise regularly but gently. Walking or swimming helps joints and mood. Eat a balanced diet rich in fruits, veggies, and omega-3s, like in fish or flax seeds. And manage stress. Try deep breathing, journaling, or talking to a friend. These aren't magic cures, but they can help your immune system stay calm and balanced. Good news, science is moving. Recent studies show that most people with UCTD, about 70%, never turn into a serious disease and stay stable for years. Doctors are now using better tools to predict who might progress, like checking specific antibodies or gene patterns. Some researchers are testing whether starting treatment early, like with hydroxychloroquine, can prevent worsening symptoms. There's also new focus on treat to target, setting clear goals like no joint pain or normal blood tests, and adjusting treatment to hit them. And telemedicine is helping patients track symptoms from home, like using apps to log pain or fatigue. It's not just about medicine, it's about living better with more control.